outbreaks. We continue to have 7 cases at the Fraser Valley Specialty Poultry, 56 at Superior Poultry, and 35 at United Poultry. 134 cases, the same at the Mission Federal Correctional Institution, and 16 people associated directly with Coral Lake in Alberta. And of course, as we've mentioned, that's an ongoing concern for us and for our colleagues in Alberta. Of the cases here in BC, 76 are currently in hospital, and of those, 20 are in critical care or ICU. We have an additional 2 people who have died from COVID-19 in the last 24 hours, bringing the total number of people who have died to 126 in British Columbia. That includes 1 person in Fraser and 1 in Vancouver Coastal Health. And our condolences go to their families and their loved ones, their communities. We have 1,512 people who have now fully recovered from COVID-19. Yesterday, the Premier outlined our BC Restart Plan, and as lots of information was provided, I assume people may have a few questions. And I know everybody is working hard to put the details behind what we announced yesterday. I will remind people we are now in phase 1, and we continue to be in phase 1. And that means we must continue what we are doing for a bit longer. That is important for us. We need to continue the measures that we're taking to bend our curve down and to get this under control. Yesterday, the Premier announced we'll be ready to move to phase 2 after the May long weekend, so it's not much longer now. This is something we can all look forward to, even if it's not quite here yet. And we will be watching very carefully to make sure that all of that we're doing will continue to make it safe for us to expand. We ask you to please continue to stay at home if you can, as much as possible, and to be respectful of those around you if you do go out. We all have our stories, and we all have our reasons for doing what we're doing, and we need to be understanding of each other through these times. It's still very much a necessity for all of us to continue our safe physical distancing, our washing our hands regularly, avoiding non-essential personal travel, and those things are things that will not change, even when we move to phase 2 in the coming days. We need to have a slow and thoughtful reset. We do not want to undo all that we have done. And even as we shift into this next phase, not everyone will be ready to increase their social connection or to restart their businesses at the same time. We don't expect that on one day, all of a sudden, everything will be open and back to normal. Just because it's allowed as well doesn't mean that everyone must or should change what they're doing now. Each of us must use the individual principles that we've set out and guide our own actions moving forward. I know some people are looking for very clear direction and rules that everybody must follow, but we recognize that everybody's circumstances are unique. We all have our own experience of this, and we all have our own experience of our households and our families that we need to keep in mind. Our health, our work, the people in our physical distancing bubble determine our personal approach to the next phase of this. All of us need to think about who we are bringing into our bubble, our orbit, as we move into the second phase, and in many cases we'll be able to increase our bubble. But if you are caring for elders at home, a senior, somebody with a health condition, somebody who's going through cancer treatment, for example, or somebody who's awaiting surgery now that we have started our restart of our surgery programs, your risk has not lessened, and you may want to continue the measures that you're taking now and looking to others to help support you in doing that. You may need to keep your circle quite small in the coming days. So before you go out and meet your friends, think about their family, think about your family. I said this before, that our mantra for the next little while is going to be few faces and big spaces. Let's remember to keep our space between us and to be careful and mindful of those who may be more vulnerable in our families, in our communities. That's the only way that we can continue to keep transmission low and keep it under control so that we can restart in an effective way. For businesses, we are working public health with WorkSafe BC, and we're going to outline the specific requirements. We're working with many different industry and sector associations, so we're going to have those details for you to be followed for your business sector and your workforce. Template plans and checklists will be available, and they're being developed even as we speak. We started on this some time ago, but it takes a bit of time. So the basic principles that we outlined yesterday and that I've outlined a number of times will apply across all sectors. So businesses will need to make decisions for themselves, however, based on your ability to meet those requirements. So some restaurants and bars, for example, some hair salons, they may not open. Like every family, every business is also unique and depends on who works there, who you serve, who your clientele are, and the physical setup of your business. So it may be gradual for some. It may be not an effective business proposition for others. So we do not expect that everybody must follow the same plan. It will depend on your own business, the people who work, your employees, and making sure that they stay safe, and the people who use your business are able to be safe. Individual plans for every business that will be opening do not need to be submitted for approval, but you do need to ensure that your plan is publicly posted, and this is how we have accountability to each other and how we can ensure that everybody understands the measures you're taking to keep your employees safe and to keep customers safe. That we can build confidence together that we are taking the appropriate measures that we all need to do to make sure that we can kickstart our economy and that we can have confidence that we're doing all we can to protect each other in this next phase. Of course, underpinning much of our next phase is restarting our health system, and we're taking a whole of healthcare approach for that as well. And as the Minister and Premier outlined earlier today, a surgery renewal plan has been launched to address that very important backlog of scheduled or elective surgeries and the people who have been most affected by those over the past few months. But we need to maintain our surge capacity within our health system to make sure that we can deal with people who have COVID-19 over the coming weeks and months and do it safely for everybody so that the surgeries can ramp up and people can get all of the care that they need in a safe way. And part of that, of course, is what we do in public health to continue to monitor, to continue to test. And our testing strategy allows for anyone who has symptoms in BC of COVID-19, even the mildest symptoms, to be able to get a test for this. As well, we have public health teams that will continue to be on high alert, monitoring and contact tracing anybody who develops COVID-19. And this, of course, works best and is most efficient and is able to protect us all when we keep our circles small. And that, again, comes back to your choices and your decisions around expanding your circle in a limited way in the coming weeks and months. All we do together helps us manage this so that we can get on with those social connections and the economic engines that we need to keep going. Then it's also about delivering care in the safest possible way to all of us who need it in the system. So like everybody around the world, each day COVID-19 brings new challenges, but also new learnings, and we will adjust in the coming weeks and months as we learn. We're learning as much as we can so that we are prepared for what may come in the fall, and I've talked about this many times about our concern that we may have a resurgence in the respiratory season in the fall. We know that we will have influenza in the fall, so we're planning now for how can we best maintain our systems, how can we strategize to reduce the impact of influenza and to monitor very carefully for COVID-19. So let's continue to stand together in our pandemic, at least in spirit, while staying apart. The future is in our hands, and we must continue to wash them and continue as well to be kind and to be calm and to be safe.
Thank you very much, Dr. Henry. I want to join Dr. Henry, and I know on behalf of the Premier and everyone in the government, I think everyone in British Columbia, to pass on my condolences to the families of the two people who've passed away from COVID-19 in the last 24 hours. One lived in the Vancouver Coastal Health Region, the other in the Fraser Health Region. We know and we understand every day what a difficult time it is. Both individuals lived in long-term care, and we know what a difficult time it has been in long-term care and what a difficult time it must be today for all those families, and we are with them in this moment, and we pass on our deepest sympathies to everyone involved, from caregivers to family members to friends. As Dr. Henry has said, we have 76 people who are hospitalized today. That's an increase of 2 over yesterday. That's 41 in Fraser Health, 2 in Interior Health, 2 on Vancouver Island, 3 in Northern Health, and 28 in Vancouver Coastal Health. We continue to have a significant number of beds available in the acute care system. That's 3,948. Our level of capacity currently is 64.6. Against the total number of beds, the level of, should I say, of occupancy, the level of activity in critical care beds is 48.2%. We had 4,557 emergency room visits yesterday, still down from our pre-pandemic levels of emergency room visits, but a significant increase over last month. I also want to acknowledge today our respect for all the people, the families who've lost people in the other public health emergency, the overdose crisis. We know the pain that that's causing, and we know the huge continuing effort for all of us in society and for us as a government in responding to that situation, which continues to be an enormous problem, an enormous tragedy in our communities. We must continue to take action, and you can believe that we will, led by our Minister of Mental Health and Addictions, Judy Darcy. I want to update you, because yesterday we had our presentation yesterday. I wanted to update you on surgery information. I referred to some of this information this morning, but I just wanted to bring you up to date on the surgeries that have been completed in this period. All of these are emergency or urgent surgeries, and they show how busy and how effective many people in our healthcare system have been during what's been this extraordinary period of dealing with COVID-19. We've completed from March 16th to May 3rd in the healthcare system 17,308 surgeries. That's 2,971 in Interior Health, 5,391 in Fraser, 3,531 in Vancouver Coastal Health, 3,437 in Vancouver Island Health, 1,010 in the Northern Health Authority, and 968 in the Provincial Health Services Authority. The amount of effort, because those cases are urgent cases, many of them involving cancer, others involving cardiac cases. These are significant cases, and this is extraordinary work done in very challenging conditions. And I want to acknowledge the people from the BCNU and the Doctors of BC, from the Health Sciences Association and the HEU, for the ambulance paramedics who brought many people to hospital to prepare, especially for emergency and urgent surgery. I want to thank all of them for their extraordinary work in this very difficult time on the issue of surgery. I also wanted to give you a second update on the single site proposal. This is a proposal in long-term care that will have people working in long-term care, as you know, working at a single site. Again, I want to acknowledge the HEU, the BCNU, the BCGU, the BC Care Providers, the Health Employers Association, and many more who have been working and have supported this change. I want to thank Stephen Brown and the team of the Ministry of Health and the health authorities for working to implement this complex and necessary shift in our approach to care. As I noted last week, there are 45,000 unique employees in BC long-term care facilities, assisted living facilities, private hospitals, and standalone extended care hospitals and provincial mental health facilities. Of these 45,000 employees, there were 7,350 employees who had jobs at multiple facilities. We started with 545 facilities that hosted multiple facility employees. Here's where we are right now in dealing with this complex situation. Of those 545 facilities, 365 have completed their single site plan. That's an increase of 89 sites from the 276 reported last week. That's 84 in Interior Health, 42 in Fraser Health, including 2 Provincial Health Services Authority sites, 103 in Vancouver Coastal Health, including 6 Providence Healthcare sites, 106 in Island Health, and 30 in Northern Health. I want to note that the number of site plans I've announced today are the ones that are completed. We are continuing to work, and we'll have more to report next Thursday. This transition involves thousands of workers who deliver important care to residents and patients. The work they do and where they do it is work that patients or residents and their families count on. That's all of us, that all of us count on. They deserve our respect and our gratitude, and we thank them very much for all they are doing. I wanted to speak very briefly, as we're talking about long-term care, about the continuing restrictions on visits. We know that Mother's Day is Sunday, May 10th. We know that this is a time, one of the many times, when people get together. We know that every day is difficult when we can't visit our parents or our grandparents or our friends in long-term care. The restrictions that have been placed on visitors in long-term care and acute care must continue. We have 22 active outbreaks in long-term care sites, as Dr. Henry has just reported, but we know how difficult this is. Personally, I know how difficult it is. My family does, and I know so many of other families in BC understand how difficult it is. We have to, of course, find ways, and this can be done sometimes through FaceTime to connect, but these are very challenging times for residents, for staff, and for the families of people in long-term care. We are with you. Of course, we are working on ways to improve the situation, but that has to be done with the primary goal of ensuring the safety and the health of people in long-term care. We will continue to work on this issue. Finally, I just wanted to reiterate and support what Dr. Henry has said. We have some distance to go in our efforts, to say the least. The Premier announced changes yesterday that we hope that we'll be bringing into force, a new phase that will come into force after the Victoria Day long weekend, after the May long weekend. That restart plan is a path to economic and social renewal, but we continue to be in phase 1. We continue to need to be together to flatten the curve. It is critical. It is critical for all those waiting for surgery that we do this, for all of those in long-term care that we do it, for our healthcare workers who have performed so remarkably in this period, for all essential workers who have done it. We need to stay 100% all in now as we work together to develop the plans to open up social and economic activity in the coming days. This can be a summer of renewal, but we need to continue to be 100% all in, even as rules perhaps change and as opportunities to engage with one another increase. We have to be committed together. I was asked this morning whether I thought that we were being too permissive. I would say that from the beginning, Dr. Henry has imposed in many ways fewer orders than other jurisdictions, and there have been fewer rules. But what's happened in British Columbia is the people of British Columbia have been committed to ensuring that we all join in the fight against COVID-19. And the results, when we see those results, when we see the modeling, when we report on those reports, when we look around the world, are admirable, and they reflect what people in BC have done. There is no effort in BC amongst the overwhelming majority of people to get around any rule. But we have to continue to dig in and work hard so that our opening, when it comes, when the new phase comes after the May long weekend, means that we can continue together in the necessary fight against a COVID-19 that does not have a vaccine or a cure. Let's stay together. Let's, as Dr. Henry says, stay calm. But let's continue together to fight against COVID-19. Je veux dire quelques mots en français. Aujourd'hui, nous annonçons 33 nouveaux cas pour un total de 2288 cas de COVID-19 en Colombie-Britannique. Nous sommes attristés d'annoncer 2 nouveaux décès liés au COVID-19, dont un à Vancouver Coastal et un à Fraser, pour un total de 126 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches. Comme indiqué dans la mise à jour de la semaine dernière, la Colombie-Britannique compte 45 000 employés uniques dans les établissements de soins de longue durée, les résidences personnes âgées semi-autonomes, les hôpitaux privés et les établissements provinciaux de santé mentale. Sur ces 45 000 employés, 7350 employés travaillent dans plusieurs installations. Nous avons commencé avec 545 établissements qui accueilleraient des employés de plusieurs établissements. Voici où nous sommes actuellement face à cette situation complexe. Sur 545 installations, 365 ont achevé leur plan de site unique. Cela représente une augmentation de 89 sites par rapport aux 276 signalés la semaine dernière. Cela fait 84 en Interior Health, 42 en Fraser Health, 103 à Vancouver Coastal Health, dont 6 dans Providence Healthcare, 106 en Island Health et 30 en Northern Health. Je tiens à noter que le nombre de plans d'emplacement que j'ai annoncés d'aujourd'hui sont ceux qui sont terminés. Comme je l'ai dit dans la présentation du rapport précédent, nous ne publions pas de plan d'emplacement unique partiellement achevé. On va parler de cela la semaine prochaine. Thank you very much. We're happy to take your questions.
Thank you. Just a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to one question only. I would also ask that you please unmute your phones. You will not be audible until I call your name. First question is from Penny Daflos, CTV.
Hi there. Thanks so much for taking my call. When it comes to resuming personal social interactions, I'm hearing from many people who feel confused and overwhelmed by the decisions they have to make now. So I'm just hoping that you can provide some more guidance for being around family and friends again. You know, can we expand our circle by only the same 2 to 6 people or have different small get-togethers? And I'm hoping that maybe Dr. Henry can just walk us through going to visit a close friend for dinner. You know, are we sitting 2 meters apart at the dinner table? Are we going in for that hug?
I know these are so challenging things, and I think part of this is, you know, we've all been so conscientious about doing our bit, and that is so important. But it is also important to make sure we have connections with people, and particularly with our families. And that's why, you know, what I want people to think about is starting small. And so, yeah, have you know. Expand your circle, and in New Zealand they've been talking about, you know, double your bubble. Okay, that's a way of thinking about it, but don't make it you know, 2 people one night, 4 people who are different the next night. What we want to do is make sure that we increase our social connections with the people who are close to us, but that we are very mindful that if we have connections, we're then connected with their connections, and that increases our risk. So if I'm somebody who has somebody in my family, if I have an elder who's living with me, then I want to be more cautious about what I'm doing. Or if I'm going back to work and my children are going to daycare, or they're going to spend time with my grandparents, then maybe we don't have them have play dates with their other children right now. So we still need to be cautious. This is not going back to where we were in December, where we had multiple mixing and congregating. We still want to keep close, but we need to expand. We all need that social interaction, but do it in a thoughtful way. And there's no, you know, everybody's circumstance is quite different. So if I'm a person who lives alone, then, you know, I can find a number of other, a small number of people who we can be each other's bubble over the next little while. If I have a large family and I have elders or people who have underlying illness, you know, I might not want to expand my family too much right now. I want to keep us close so that we can all be safe. So it's we will provide some guidance, and there'll be some more information up on our website, as I've said. But the basic principles are, yes, let's keep our social distancing. If we're going to have something in our neighborhood and have people over for a barbecue outside is better than inside, because we can maintain those distances, and that helps protect us all. So it is a little bit of, it's hard to give hard and fast rules, but we want small numbers, we want outside, we don't want people congregating, we want us to do it in a safe way so that we continue some of the measures that we've had to stop transmission of the virus, but increase our social connectedness in a physical way. So absolutely, you know, hug your grandparents if they're your people. Hug your friends if you haven't seen them, the friends that you've chosen to be each other's bubble. You know, that's important. And of course, hug your family, your household every day. And I say this to my the teenagers in my life, especially hug your teenage sons and daughters.
Next question is from Marcella Bernardo, News 1130.
Dr. Henry, this is another tough question that I have to ask, partly because it's personal for me, but you mentioned yesterday that it's going to be a long time before we can see concerts and festivals and music entertainment in nightclubs and things like that. How far down the road do you see phase 4 being when it comes to how soon we can lift those kinds of restrictions?
Yeah, that's such a challenging thing. We know that those are the types of environments where we have seen transmission of this virus, both in Canada, here in BC. I look back to a large conference that was held just before we had the full recognition of what was happening, and we've had 87 people in British Columbia alone who were infected because of that, the meeting at that conference, and nobody intended that to happen. We've seen the same thing with funerals, with birthday parties, with concerts, with events that people have come together, and those types of environments. And South Korea has a number of outbreaks related to people who got together in bars and nightclubs before they put in restrictions. So these are the environments where we know this virus can take off. And often it's young people who may not actually realize they're infected or have very mild illness, and then we bring it home to our families and our communities. So those are the types of events that I do not see happening this summer. Unfortunately, this is going to be a different summer for us. I don't see it as being forever, but this summer around the world, I cannot see these things happening. And I've been on I've talked about this before. I'm part of an international group with the WHO that looks at mass gatherings. And there is nobody around the world that is talking about having mass gatherings in this environment that we're in. So this is not something that's unique to BC. These are things that we're worrying about and we're watching around the world. If we have an effective treatment, if we get a vaccine very quickly, we're learning more about this virus as we go. I don't think this is going to be an issue next summer, but that's my belief. I don't have any data to support that yet, but this is a very unique circumstance we're in, and we're all going through it together. And these are some of the events where we know transmission can take off, and then we can go back to back to our communities and our families and spread it. And we only have to look around the world to see the types of things that have been changed. We know that all of the major sports events have been canceled. There has been talk, and in Germany, the NHL here, about how can we have some sporting events come back, but without the audience, without the mass gathering part of it, through this phase of what we're going through in this pandemic. Things that would be completely unbelievable, like canceling some of the events around the Hajj. These are things that we have taken around the world because there is so much we don't know about this virus, and because it can be so lethal in some populations. So that's kind of a long-winded way of saying I don't see it happening this year. I hope that when we have a vaccine rapidly, and that as we learn more about this virus, we'll be able to get back to that type of contact as soon as we can.
Next question is from Richard Zisman, Global News.
Dr. Henry, just further on some other types of groupings.
We lost you, Richard. Can you start again?
Oh, yeah, I'm still here, Dr.
Okay.
Henry. Just wondering if there's any clarity on religious gatherings, church, synagogue, what it's going to look like, and phase changes there fall under. Also in terms of recreation centers and gyms and fitness clubs, if there's any clarity there in terms of what phase and the timing. And you mentioned the institution that reopens will need to have some sort of signage explaining to patrons how they're meeting the guidelines. Can you explain a little bit what that will look like?
Right. So a couple of things. When we talk about religious gatherings, I do not see any change with religious gatherings in that, we have restrictions on how many people can be at an event together. We need to maintain physical distancing. So that limit is at 50. And that is only applies if you're able to maintain physical distancing within that limit. So if you have a very small church, for example, and then 50 may be way too many. For funerals, for example, we've seen where small funeral homes, it may be limited to immediate family, 2 or 3 or 5 people, depending on what can be managed safely within that environment. So those are the restrictions that are going to be in place through the summer and the fall, and we'll, of course, reassess as we learn and as we find out what's happening. Same with, gyms. We have had transmission of this virus in gyms in BC, and that's why in some areas of the province there have been, those facilities were not able to meet the requirements, clearly, because there was transmission that happened associated with some facilities, and that's why there was orders in some parts of the province. So again, we will be working with that sector. I don't see gyms being in the second phase. We're looking at probably the third phase if things continue to go as well as they have been in terms of numbers of cases, because again, there will be restrictions, numbers of people depending on the size of the facility, your ability to clean, they not congregating in the washrooms or the change areas. So there'll be measures that will need to be in place in community centers, in gyms, even for outside. And we've talked about, I think it's very important in the summer, so we're talking about June, July, that we start looking at what types of sporting things we can have in a safe way for children and for adults. So there are some sports that are much more amenable to that than others, and they may look a little different this year. There may not be as many parents standing on the sidelines, or at least standing on the sidelines and maintaining your safe distance from each other, and those types of things. We're working with the sports associations, actually nationally, to make sure that we can have some common guidance across the country, and those are things that are happening now. So that's for the future. In terms of what we're talking about publicly posting for every business who has been under order, and I'll be modifying those orders as we get closer to the time, they need to demonstrate both to their employees and to their customers how they're meeting the requirements that everybody will know about. And so whether that's posting online or posting something in your window, either way, it's so that we can all be reassured that we're doing what the best that we can do to stay safe. And so it's part of our social contract. Businesses will say, here's what we're doing. We, as consumers, will have to play our part as well, which means making our appointment, making sure that we don't congregate in large numbers, maintaining a respectful distance, our safe distance from people, cleaning our hands, not going out if we are sick. And I think that underlines everything that we need to be careful about in the coming weeks and months. And this needs to be our mantra. Even if we are feeling the least bit unwell, we need to recuse ourselves, to stay away from others, especially our family, our friends, our close contacts. They are the people that we are most likely to affect and infect. So that's got to be the basic underpinning of everything, and part of our work together over the next months until we make our way through this pandemic.
Next question is from Hina Alam, Canadian Press.
Hi, Dr. Henry. I just wanted to go back to the long-term care facilities, and we in BC have fared better than some of the other provinces. I was wondering how much worse it could have been if we had not taken the steps we took to control the number of outbreaks and deaths that we had. And I also was wondering if I could get your thoughts on what you think would be the second wave of the pandemic. Thank you.
Yeah. I think we were hit early and tragically in our long-term care sector. In the Lynn Valley Care Centre, which I'm so thankful that outbreak is over, but it was only being able to be declared over earlier this week. And think of that, it's been months that facility has been living with this hanging over them. But we learned from that. We learned from Harrow Park, which is also, gone a couple of weeks now without new cases. But it has been very challenging, and it's been challenging on every front. It's been very challenging for people who are working in long-term care. And so the measures that we took because of that early outbreak, really the team approach to a SWAT team approach, we call it, to going into every facility that has an outbreak, the very sensitive surveillance we've been doing, the testing we've been doing. Many of the more recent outbreaks have been a single or two cases, and that speaks to the importance of the early detection, that our system is working, we're finding people, and that we're able to manage them. But one cannot compare. There have been the majority of our deaths, 78 people who've died have died in long-term care. And, those are seniors and elders who have history and our families and our lives, and we cannot minimize the tragedy that those deaths are. In terms of the second wave, we don't know. Part of me, the optimist or the one who hopes, maybe there won't be a second wave. But every other pandemic in recorded history has had at least 2 waves, some more. Whether the second wave will be more severe than the first, whether there'll be a series of smaller waves, I don't know. I don't think anybody knows. There's a lot of theories around the world. What I do know is that we need to keep putting the pressure on this virus to make sure it doesn't take off. And that means we can't expand our circles too much in the coming weeks and months, because we don't have immunity, and nobody around the world has sufficient immunity to prevent transmission of this virus, even those places that have had more severe outbreaks. And we can see how it can very rapidly increase and accelerate an outbreak very quickly. Other thing I do know is that influenza season comes every year, and we expect we will have influenza this fall. We don't know if it's going to be a severe season or not, so we were going to have to do everything we can to minimize influenza, and that means the importance of influenza immunization and the measures that we're taking to prevent COVID now that we're thinking of will also prevent influenza. So we have to be mindful of that coming into the fall. It will also make it more difficult when we start having influenza season, detecting COVID outbreaks, because we know that we'll see a lot of people ill with influenza again. So it's all very, complicated. There's a lot we don't yet know, but as I've said, we're watching and learning from everybody. We talk with colleagues around the world. There's much research going on into treatments. There's a lot of research going on to vaccines, the surveillance and the work that we're doing in public health to try and keep track of this in our community and be very sensitive and monitor, and then everybody else doing their part by making sure we keep our contacts manageable, so that if one of us does get infected, we're able to stop those transmission chains very quickly. So that's the best I can do for prognosticating.
Next question is from Tanya Fletcher, CBC.
Dr. Henry, if businesses work with their industry associations to submit their plans for reopening, what will enforcement look like? Like once a store, as you mentioned, publicly posts their guidelines, who will eventually monitor that compliance? Will it be WorkSafe BC?
Yeah, so there's a combination, and not every business belongs to their business association, but the intent is to have templates and checklists that they can use, and then public reporting. Yes, so WorkSafe BC has a role in worker protection. In public health, we have roles in inspecting food premises, for example, in a number of other settings. So there will be proactive inspections based on a risk assessment in different sectors. But there also will be a complaints-based process. So if an employee is concerned about the fact that they feel that they're not being protected or that the plan isn't sufficient, then they can go to WorkSafe. If it's a public concern from somebody who doesn't feel that it's safe, then public health can be part of helping inspect on a complaints basis as well. So that's what we're looking at. Again, I believe that most businesses will do the right thing because this means that they're protecting their employees, they're protecting their business, and it builds confidence in all of us that we can do these things safely. And that's how we're going to get our economy going again.
Next question is from Simran Singh, Daily Hive.
Hi, Dr. Henry. Thank you for taking my question. I just want to know, are you worried in any way that people will be out in full force come May 19th? Beaches are already pretty full with people trying to distance, I guess. But is there any kind of concern or worry that things will go full speed too quickly? And then how many steps back will the province have to take if that does happen?
Yeah, no, I actually, maybe it's the optimist in me again, but I think we have shown that we take this seriously and that we understand our responsibilities to our community, and particularly we know that this virus affects those who are close to us. It's most likely transmitted when we're spending time with people mostly with people that we care about, people that we're in close contact with. So I believe people will do the right thing. And I see that every day. We see people outside, but they're sitting apart from each other. They're talking to each other. There's lots of people going outside, which I feel is incredibly important for our mental and physical health. So now we just need to continue to be mindful of that and respectful of each other when we do that. We don't always know other people's stories, and I know, I know people who will be looking forward to going and checking on a relative who's been alone for the last couple of months. Those are important things to do. We know that people who are taking friends outside for the first time for a long time, those are important things to do. A single parent who has both kids with them going grocery shopping, sometimes it's because they don't have somebody that can care for the kids for that period of time. We need to be compassionate with each other and supportive of each other, and when we do that, most people do the right thing.
So we have time for one more question today. And for a reminder to all reporters that didn't get to ask a question, there will be a statement released this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Keith Baldry, Global News.
Thank you for this. Dr. Henry, I couldn't help but notice you began the briefing with a reminder we're still in phase one and will be for a few days yet. Is that reflective that there's probably a bit of confusion out there about how all this is going to work in terms of reopening? You mentioned templates, and still a lot of work needs to be done to sort out the details. So are people sort of getting ahead of themselves?
Perhaps a little bit, and I think we're all eager to think that we're through the phase, and we had 33 new cases today. Some of them we're still investigating. We're not clear yet where the transmission happened. We have thousands of people who are coming back, Canadians who are returning from countries that are still in the throes of a very serious upswing in cases. So, we need to be mindful of that. While we have decreasing numbers, thankfully, in hospital and ICU, there are still people out there who are being in isolation because they've been in contact. And we know there's nothing we can do to prevent them from getting ill. We just need to monitor them and make sure that that next chain of transmission isn't happening. So if we move too fast, too quickly, or too much too fast, we're going to see dramatic increases, and again, that will set us back in a whole number of ways. So now we're still in that pause. We're still taking it slowly and thoughtfully, and I'm confident that if we continue to do what we're doing, by the long weekend, we'll be able to very slowly and cautiously start the opening up process as well.
Thank you.